So let's talk about UTI. So what even is what even is a UTI, right? So UTI essentially means you have a infection. So you have an infection anywhere in the urinary tract. So that could mean you could have it in the urethra, the bladder, the ureters, or even the kidneys, right? So essentially that's what it is. This is an infection that happens anywhere in the urinary tract. Sorry about that. So now let's go more into what kind of causes a UTI, and let's delve into that. So what causes a UTI? So I want you to divide this into two kind of categories. The first one is predisposing factors. So these are factors that can either be behavioral, or it can be anatomical, and this kind of leads to an increased chances of there being UTI. And now, actually, what kind of specific pathogen causes that UTI is what we'll delve into just in a bit. So in terms of predisposing factors, what can cause a UTI? So number one, you have sexual intercourse. And the reason this makes sense is because, in sexual intercourse, it's not always the most sterile. You can have, cross-contamination from the different individuals, and you could have pathogens being kind of exposed to the other person through that. The other way is wiping back to front. So if you're wiping back to front, you have your kind of your fecal matter that you're kind of wiping from the back to the front. So you're bringing that kind of fecal matter into your urethra, and that's what causes chances of increased chances of there being a UTI. Now, the other thing is diabetes. Why diabetes? So in diabetes, you have glucosuria. So you have glucose in your urea. And that just kind of gives food to the bacteria. So it's a lot easier for bacteria to live in kind of, those places where you have a lot of food. Now, anatomically, females are more likely to get it. That's because the urethras are a lot shorter. So if your urethra is a lot shorter, it's a lot easier. So let's say this is my my urethra right here for a female, and then this is a bladder, and then for a male it's a lot longer. So for a female, it's a lot easy for the bacteria to kind of come up and kind of go into the bladder. Or it's a lot harder for a male urethra, or a pathogen in a male urethra to kind of go up and go into the bladder. That's another reason. The other thing is pregnancy. It's just you have increased progesterone levels, and that kind of makes it harder to kind of empty the urine. So you have something called urine stasis. Urine stasis. So urine stasis, where you have urine kind of staying there. If you think about that, so if you just have urine stasis, so you have urine kind of staying there in that place, and you're not really excreting the urine. If you think about it, like if I have the urine there, you have all the bacteria there. Urine kind of helps the bacteria get flushed away, but in this situation, there's no flushing. That's what happens. Now, in terms of what exact pathogens can cause this, the number one type of bacteria, kind of pathogen is bacteria, right? Bacteria is the most likely to cause a UTI. And the way to remember this is called keeps. So I want you to remember keeps as a way to remember the bacteria. So what's K? So K is Klebsiella pneumoniae, right? E is E. coli, which accounts for 90%. So if you ever get a question like, what's the most common cause of UTI, it's E. coli. E. coli causes 90% of all UTIs. Then you have, Enterococcus, Enterobacteriae. You have your Proteus, Pseudomonas, and then you also have your staph kind of bacteria. And again, these are not as common. The main you want to remember is E. coli, Klebsiella, kind of very common stuff. And it's not just bacteria. You can get, fungi. So you can have candidiasis, or candida causing the UTI. And you can also have a virus. So, what kind of viruses would cause this? What viruses would cause this? You have adenoviruses. So let me just write that down. So you have adenoviruses that can cause this. Cytomegalovirus, CMV, can cause it as well. And you should look more into what these are exactly if you want to know. But again, not as common as bacteria. Okay, cool. So let's say you've had these predisposing factors, you've had a pathogen exposure, and that leads to a UTI. Now, what is the pathophysiology of UTI? So the pathophysiology of UTI is very common. So basically, what you have number one step, you have contamination. So, the pathogen enters the urethra due to all these risk factors. You have some sort of contamination. Very easy stuff to remember. Okay, now number 2, you have colonization. So, these bacteria. So, you imagine all these bacteria. They have something called, virulence factors. Something called virulence factors, right? And these virulence factors are pretty much like, I like to think about the superpowers that they have to make it harder for the body to fight it. So, what are some of the common virulence factors that bacteria, especially that cause UTI, might have? It's called fimbriae. So they have fimbriae, and what they are, they're like hair-like projections on the surface of the bacteria, and they attach to the epithelial wall. So pretty much it's like like almost like a spider, right? And they're able to attach to the wall, and it makes it harder for the bacteria to get flushed away when you get urine, right? Another thing is capsules. So capsules is another virulence factor. There's a bunch of them. It's not just these two. There's a bunch of virulence factors. But another common one is capsules. So there's a thick kind of layer around the cell, and this kind of stops phagocytosis. So phagocytosis, if you guys remember, essentially phagocytosis is when you have like macrophages or immune cells that kind of go up and eat the whole bacteria. They'll literally eat the bacteria. They'll phagocytose the bacteria. But if this bacteria has some sort of this kind of thick gelatinous layer around the cell, it makes it harder for the macrophage to kind of go and eat it. That's essentially what it causes. Okay, cool. So you have that. Now, what's the third step? So the third step is displacement. So pretty much what happens is, if you can imagine all this, let's just say this is my my urethra for some reason. You have all these bacteria, all these pathogens, or whatever's causing this UTI, kind of taking up all this space. And when you have normal flora there, because again, the UTI, you have other flora, you have other bacteria, other pathogens in there, or not pathogens, other bacteria that live normally there. Like for example, lactobacilli, you can actually displace them. They're getting displaced, and they're actually competing for the food there, right? So slowly what happens is they will start overtaking, and they will start overtaking the normal flora that's actually in there. Okay, cool. So now, okay, how can before we go into we'll go into, I guess, how this works, right? So I guess what kind of symptoms it causes, and then we'll go into classification. So in terms of symptoms, the number one thing to remember is an immune response trigger, right? So your immune system is responding to this, and it's going to release neutrophils, and that's going to cause inflammation, right? So you have your immune system knowing that, look, there's some sort of bacteria in my urinary tract. Let me send some neutrophils, and that's going to release their own cytokines to cause inflammation. Now, this inflammation, and when these cytokines are released, they can actually go systemically. So these cytokines can be released systematically, not just in the urinary tract. And if they are released systematically, they can cause fever, they can cause malaise or tiredness. Okay, now that's very common. You can get that. And it's important to know that not all UTIs are going to be symptomatic. You can have a UTI and might not be as symptomatic. So it's not always that you're going to get these kind of features. You're going to get suprapubic tenderness. This is just because you have this inflammation, which is kind of irritating the lining in kind of your bladder. It's irritating the lining, and that's kind of causing that tenderness that you can have when you have a UTI. And again, all this inflammation is going to cause increased white blood cells to kind of come in there. It's going to cause increased nitrites and leukocytes. So again, leukocytes are just white blood cells essentially, and nitrates are kind of what is released. It's like a waste product almost. You're going to see increased nitrates by the pathogens, and then foul smelling urine. That's just one of the things. Now also, because this bacteria is irritating the epithelium, you're going to get stimulation of the urinary reflex. This is kind of the reflex to pee, right? The reflex to release your pee. So you're going to get increased urgency. So they want to they have this intense need to go, and it's very urgent, right? Increased frequency, so they're going to go a lot more often. So dysuria, they have some pain or discomfort when they're peeing. And the nocturia, so they're peeing a lot in the night. That's what nocturia is. I'm not sure what the exact definition is, like greater than 2 times a night or something like that. And then the bacteria can actually then ascend into the kidneys, and this is called pyelonephritis. So pyelonephritis, very important to remember, is when the UTI or the pathogen actually ascends up from the bladder to the ureter to the kidney, and this is a very serious thing because you have kind of bacteria in your kidneys. Okay. The other thing can cause, this is especially for elderly, can cause altered fluid status. So it can cause electrolyte disbalance, it can cause stress, And in the elderly, it can cause delirium because you have electrolyte disbalance and this kind of screws up. And then they function and it causes delirium from the elderly. But in terms of if you want to remember all the symptoms, this is the best way you want to remember Hugg's Fund. So let's actually quickly go over Hugg's Fund. And this is just a mnemonic to remember all the kind of symptoms of a UTI. So let's go over Hugg's Fund. So Hugg's Fund, H is for hematuria. So hematuria. So this is blood in your urine. U for urgency. Right, hematuria, urgency. G is for just general malaise, right? General tiredness that you get. S is for suprapubic pain. So suprapubic pain just above your pubic kind of area, and you get pain. Right, so this is kind of everything we discussed here already, and I kind of showed you the way it works, but this is just a quick way to remember it if that's that's what you need. Then F is for frequency. So again, increased frequency because your epithelium is irritated by the bacteria. And then you have U is for urine changes. So again, so this is that could mean you have a more cloudy urine. This is because of all the white blood cells and cause cloudy protein, right? Smelly and dark. And then N is for nocturia, so you're peeing in the night. And then D is for dysuria, so pain or discomfort while you're peeing. And that's kind of the way to remember the symptoms, right? Now, real quickly, just before we go to diagnosis, I want to kind of talk to you about the classifications of UTI, right? Let's just talk about the classifications really quickly because this is really important to kind of know UTI. So classifications, you have a symptomatic UTI. So if you go by clinical presentation, either it's symptomatic UTI, so you have a UTI, or sometimes you can get an asymptomatic bacteria. So there's a bacteria in urine, but there's no symptoms, and that's called asymptomatic bacteriuria. So asymptomatic bacteriuria, and mind my spelling, so it's ASB, right? That's one thing, and yeah, sure, it, whatever. The other thing you need to know is by location. So a lower UTI is everything but pyelonephritis, so everything but the kidney. That's a lower UTI. So if you have infection, of your bladder, your bladder, your urethra, I'll even say that's that's also lower. No, actually that's usually classified as upper. So let's take that. So pretty much bladder and urethra are lower, lower UTI. And then upper UTI is just your, your kidneys, of course, so pyelonephritis, and then your ureter. So pretty much anything above the bladder is classified as upper UTI. Also, you can go by severity. So there's it's uncomplicated and complicated UTI. So uncomplicated UTI, it just means that, okay, it's uncomplicated or it's kind of expected. So for example, in a healthy, non-pregnant premenopausal female. So if you have a female usually and they're healthy and they're not pregnant, that's uncomplicated. Usually that you have a male, right? You have a male and that's a risk factor, or any if they have any risk factors present, it's a complicated UTI. So a male, pregnancy, they have diabetes, they're immunocompromised, all goes into complicated. Okay, cool. In terms of diagnosis and kind of investigations, usually the way it works is if it is uncomplicated, so if it is an uncomplicated UTI, it's got the typical symptoms, then you just start the treatment, which are antibiotics. If it's caused by bacteria, most likely, you start it without any diagnosing any further because it's not complicated. It's not complicated. There's no typical symptoms. You just start the diagnosis straight away, or you start the treatment straight away. Now, if it is complicated and there is atypical symptoms, or even if it could be uncomplicated with atypical symptoms, you want to do a urine analysis, right? So you want to do a urine analysis, which means you do a dipstick and a microscopy, okay? And then you can also do a culture if that's necessary as well. So let's say you need to do that, right? So there's two ways to get a dipstick and actually do a urine analysis. So a dipstick is very simple, and basically what you do, you can either get from a suprapubic aspiration or a midstream urine. Suprapubic aspiration, actually you put a needle into the bladder to get the wee that way, or you just do a midstream urine. So you just kind of you let initial kind of your urine go, and then you take a midstream, and that's midstream urine. So you can kind of take it both ways. Of course, this is a lot easier way and something that, you should kind of prefer. Like, I think very specific scenarios in which you'd go suprapubic aspiration. Once you do that, you can do a dipstick test. The dipstick is essentially like a little stick that you can actually put into the urine, and it will then kind of show. So usually with a UTI, nitrates. So nitrates are kind of these things that are released by these pathogens. It's almost like a waste product. So if you have a lot of nitrates, that could mean, an infection. Usually, E. coli is the most one that kind of release nitrates. Not all pathogens release nitrates. The other thing is leukocyte esterase. So leukocyte esterase is something that's released by white blood cells. So that's something you can actually see in the dipstick as well. Now, you can also send it for, a urine analysis. So you can do a microscopy, so MCS, or urine MCS. So microscopy cultures susceptibility or sensitivity. So microscopy is, you actually get the wee and they look into with the microscope, and they can look for red blood cells, white blood cells, and they look at the actual cells. Culture is when they actually get the bacteria to grow, right? So they put the thing in kind of like a little plate, and then they let it grow. And that's how to see if there is bacteria present. It's kind of letting it grow. And sensitivity is kind of like they test for antibacterial resistance. So when they have the culture, they'll try different types of antibiotics and see if that kind of gives you something. Now, in terms of treatment, it's very simple. So antibiotic is recommended for all symptomatic UTIs, right? So if you have symptomatic, antibiotics is recommended. If it's uncomplicated, you just do empirical antibiotics. Empirical just means you're kind of giving antibiotics before knowing exactly what the cause of the pathogen is, right? If it is complicated, you do empiric therapy plus you do antibiotic therapy. So you do the empiric therapy, you start them on some sort of antibiotics, but then also you do some further testing like a dipstick or like a MCS to see exactly what it is caused by, so then you can better kind of suit your antibiotics. But in terms of treatment, first line is trimethoprim, second line is cefalexin, third line is amoxicillin augmentin. Again, these are different types of antibiotics, and I don't want to go into too much detail, but just kind of know that's the main gist. And that's pretty much it in terms of a UTI. And if you would like to get some Ankies, please look in the description below and subscribe. And I'll try to explain topics in the most easiest way I can.